Hello friends, once again welcome to my YouTube channel Helping Hand for Nurses. In this video I am dealing with the topic ECG, that is electrocardiogram. So in most of the exams you can expect questions from this topic. So this is the first part of the video. Please watch the full video. If you like this video, please subscribe and like it. ECG. ECG, it is a electrocardiogram. So electro means electrical activity, cardio means heart, and gram is the graph. So in short, electrocardiogram, it is a graphic recording of the electrical activity of the heart. Electrocardiogram is a graphic recording of the electrical activity of the heart. It can be written as ECG or EKG, both are same. And EKG, it is abbreviation of this electrocardiogram, which is written in Greek. Then who invented electrocardiogram or ECG? A Dutch physician, Willem Einthoven, invented ECG. What is the difference between electrocardiogram and electrocardiograph? Electrocardiograph, it is the name of the device. It is a galvanometric device that detects and records the minute differences in electric potential caused by heart action. So electrocardiograph is the name of the device which detects and records the electrical potential that is generated inside the heart. An electrocardiogram is a graphical record produced by an electrocardiograph. So electrocardiograph is the name of the device and the electrocardiogram is the graphical record which is produced by that device. Next we can see the principle behind ECG. So the ECG is based on the cardiac action potential and cardiac conduction. What is cardiac action potential? Cardiac action potential is a brief change in the voltage that occurs across the membrane of the cardiac cells. It is a brief change in the voltage that occurs across the membrane of the cardiomyocytes, is the cardiac potential. And this cardiac action potential is mainly caused by the movement of the charged ions between inside and outside of the cell through the ion channels. And in most of the skeletal muscles, the cardiac action potential that is generated is mainly controlled by the nerves. But in cardiac potential, these are generated by specialized cells called pacemaker cells. So, which is the pacemaker of the heart? It is the SA node, which is present in the right atrium. SA node or the sinoatrial node. So these are the specialized cells which have the capability of generating the action potential. One peculiarity of the cardiac muscle cells is that the muscle cells of the heart are electrically linked to each other by intercalated disc. So if an action potential or the electrical impulses that is generated in the sinoatrial node will spread through the entire heart. So from the sinoatrial node, the electrical impulses will be transmitted to both atria and from there to the AV node, that is the atrioventricular node, and from there to the common bundle and then to the bundle branches and finally the Purkinje fibers. So if you are getting an electric shock, what is happening is that it will cause a contraction of the muscles. When the electric current passes through our body, it will cause the contraction of the muscles. So in the same way, when the electrical impulses are generated from the SA node and it is transmitted to the myocardium, it will cause the contraction of the heart muscles. And the cardiac impulses transmits through the heart and spreads through the surrounding tissue and finally reaches the skin of our body. And this electric impulse in the skin is received by the electrodes of the ECG machine and is processed to produce an ECG. This picture shows the conduction system of the heart. SA node, which is the pacemaker of the cell, produces electrical impulses and it is transmitted to both atria and the atria gets contracted. Electrical impulses, it is also transmitted to the AV node and from AV node it is transmitted to bundle of His and then to left and right bundle branch and then to the Purkinje fibers. And finally the ventricles get contracted. And these electrical impulses are also transmitted to the entire surrounding tissue and to the skin. So when we place electrodes of the ECG machine onto the skin, these electrodes will receive the impulses and it is processed to ECG or the electrocardiogram. Next, we can see the difference between the ECG electrode and the ECG lead. So ECG electrode, it is a conductive pad which is attached to the skin and enables a recording of the electrical currents. So ECG electrode is a conductive pad attached to the skin to record electrical activity. So this picture shows the chest electrodes. An ECG lead, it is a graphical representation of the electrical activity of the heart and it is created by analyzing the electrodes. So an ECG lead is a graphical representation of the heart's electrical activity which is calculated by analyzing data from several ECG electrodes. This picture shows the electrodes of a 12-lead ECG and it includes 6 chest electrodes and 4 limb electrodes, total 10 electrodes, and we are getting 12 ECG leads from this 10 electrodes. So 12 lead of ECG represents the 12 different electrical views of the heart. So 12 ECG electrode records 12 leads producing 12 separate graphs on a piece of ECG paper. Next, we can see different types of ECG leads. It is classified into 3-lead ECG, 5-lead ECG and 12-lead ECG. There is a color coding system for ECG cable and it includes IEC color coding system and AHA color coding system. IEC is the International Electrotechnical Commission. AHA is the American Heart Association. First, we can see the 3-lead ECG. And according to AHA, the color coding system is as follows. That is, from the right arm, it is white, then left arm black, left leg red, white, black and red. And according to IEC, it is red, yellow, green. That is the color of the traffic light. That is a red, yellow, green. Placement is like this. It is as per AHA and it is as per IEC. Red, yellow, green and white, black, red. And the placement regarding the RA electrode, it is placed under the right clavicle near the right shoulder within the ribcage frame. And LA electrode, it is placed under the left clavicle near left shoulder within the ribcage frame. And LL electrode, which is placed on the left side below the pectoral muscles, lower edge of the left rib cage. Next is a 5-lead ECG. RA indicates right arm, LA left arm, RL right leg, LL left leg, chest. So as per AHA, that is American Heart Association, the color coding of the ECG cables is white, black, green, red and brown. And as per IEC, it is red, yellow, black, green and white. Next is the placement of the ECG leads. So as in 3-lead ECG, RA electrode, it is placed under the right clavicle near right shoulder within the rib cage frame. And LA electrode, it is placed under the left clavicle near left shoulder within the rib cage frame. And LL electrode, which is placed on the left side below the pectoral muscles, lower edge of the left rib cage. And the RL, which is placed on the right side of the lower edge of the right rib cage. And the chest electrode, which is placed at the fourth intercostal space and right to the sternum. So how you will remember this color coding? If you are getting AHA ECG cables, from the right side, we can remember it as snow over grass. So snow, it represents a white color and grass, it represents a green color. So snow over grass from the right side, snow over grass, and coming to the left side, it is a smoke over fire. smoke over fire. Smoke represents black color, fire represents a red color. So if you are getting AHA color-coded ECG cables, remember this mnemonics, that is a snow over grass and smoke over from, that is starting from the right side. And if you are getting IEC, you can remember it as fire over smoke and yellow flower over grass. Fire over smoke and yellow flower over grass. Or we can remember it as a color of the traffic light, that is a red, starting from the right, that is red, yellow, green. Then available it is a black, and the remaining white color at the chest. Next is a 12 lead ECG. So 10 electrodes are required to produce 12 lead ECG, and 10 electrodes includes 4 limb electrodes and 6 chest electrodes, and 4 limb electrodes are placed on the right arm, left leg, left arm and right leg, and 6 chest electrodes are called precordial electrodes or chest electrodes. And it monitors 12 leads, that is from V1 to V6, and lead 1, 2, 3, which is a bipolar leads or the standard limb leads. Then AVR, AVF, AVL, these are the unipolar leads. It is also known as the augmented leads. So AVR means augmented vector right, AVF means augmented vector forward, AVL means augmented vector left. And these leads allows the interpretation of the specific areas of the heart, which will give an idea regarding the ECG waves of the electrical impulses of the specific areas of the heart. For example, lead 2, 3 AVF, which gives an inferior view of the heart, and lead 1 AVL, VF, V6 lead, which will give the lateral view of the heart, and leads V1 to V4, which will gives the ECG waves from the anterior portion of the heart. Next is the 12 lead ECG color coding as per the IEC and AHA color coding system. Coming to the limb electrodes, it is similar to that of the 5 lead ECG cable color codes. So as per AHA, remember the mnemonic as snow over grass and smoke over fire. Snow over grass and smoke over fire. And as per IEC, remember the mnemonic it as fire over smoke and yellow flower over grass. Fire over smoke and yellow flower over the grass. Coming to the chest electrodes, as per AHA, remember it as red, yellow, green. That is a traffic light color, that is red, yellow, green. Then remember it as BOP, B-O-P, that is blue, orange and purple. But in IEC, V1, V2, V3 are similar, that is a red, yellow, green. But V4, it is brown color, V5 black and V6 is violet. Next we can see the placement of the electrodes in 12 lead ECG. This picture shows the color coding as per AHA color coding system. Coming to the limb electrodes, remember the mnemonic, that is from the right side, snow over grass and smoke over fire. And coming to the chest electrodes, remember the mnemonic as red, yellow, green, and BOP, that is blue, orange and purple. So V1 electrode should be placed at the 4th intercostal space to the right of the sternum. V2 should be placed at the 4th intercostal space to the left of the sternum. And V3 should be placed between V2 and V4. V4 should be placed at the mid-clavicular line, but at the 5th intercostal space. And V5 should be placed at the anterior axillary line at the same level of the V4, and V6 should be placed at the same line of the V4 and V5 but at the mid-axillary line. Once again, V1 should be placed at the 4th intercostal space to the right of the sternum, V2 should be placed at the 4th intercostal space to the left of the sternum, and V3 should be placed between V2 and V4. V4 should be placed at the mid-clavicular line but in the 5th intercostal space. V5 should be placed at the same level of the V4 but should be placed at the anterior axillary line, and V6 should be placed at the same level of the V4 and V5 but should be at the mid-axillary line. And coming to the limb electrodes, RA should be placed anywhere between the right shoulder and the right wrist. LA should be placed anywhere between the left shoulder and the left wrist. And RL should be placed anywhere above the right ankle and below the torso. and LL should be placed anywhere above the left ankle and below the torso. This slide shows the placement of the electrode in 12 lead ECG. In the next video, we can deal the leads of the 12 lead ECG in detail. Also, we can discuss regarding the ECG paper. So, thank you for watching the video.